Next, we're going to have Brynn Dechert come up. She came all the way from Michigan, Mott Children's, and she's going to speak to us on what you can do to get the best care. Brynn.
I see it.
I thought I saw it loaded here. Let's see.
Maybe it's behind the...
Maybe it's behind this.
Where is that?
Yeah, we're just having trouble finding it. It's here somewhere, we promise.
Hey, Alice. Yeah.
Do you know where her
see the
talk was?
presentations.
You don't have your slides there?
No, unless maybe it's in here. Is it in here?
Yeah.
Oh, yeah, okay.
There it is. Got it.
Perfect.
Just inside the folder. Easy enough. All right. Okay. Thank you, Dr. Kim, for the lovely introduction. I'm very excited to be here. I'm a nurse practitioner at University of Michigan. I've been part of the SADS organization, I think, for the last 8 years, something like that, 8 or 10 years, something like that. I'm also on the board of trustees for SADS, and it's a wonderful organization. So I'm very excited to have all of you here with us today. I'm going to be talking about navigating a SADS, a diagnosis, and how to speak to your medical providers, how to find the right medical providers, and what to do when you have questions and things like that. Today, we're going to go over a few things. First, we're going to go over how to find the right care, which is very important. As you can tell with Dr. Kim, Dr. Miyake, Dr. Brule, Dr. Ackerman, who's in the room, it's very important to find a person that's an expert in what the care that you need. What to expect from your team we'll talk about, what questions to ask, and then where to find information that you can read at home if you have further questions. First, I want to start with not all cardiologists are the same. And again, going back to the presentation we just heard by Dr. Landstrom, we know that he is an expert in what he does. It is important to see an expert of a SADS condition. And as we know, Dr. Ackerman has been doing this a long time. And there's a lot of other people across the country who do this very well. But there are some people who are cardiologists and may be able to help you in your local community, but you still want the expert care from other centers. So how do you tell if your doctor is an expert in the SADS condition? You could ask, how many SADS patients do they see? Do they have a special arrhythmia clinic? Many of these big centers, like Dr. Ackerman's, has a specific center or clinic that handles patients, that evaluates patients with SADS conditions. And are they a SADS advisor? Are they on the scientific board of SADS? Can they answer the questions that you have? And really, you want to make sure that they're an expert in it. The SADS Foundation can help you find an expert. So if you don't know if you're seeing a SADS expert, you can actually contact SADS and they can let you know that, yes, this person, has produced a lot of research in this area, works with a lot of these patients. SADS also has a physician referral network, so patients can be referred from SADS to the physicians that are experts in this area. So that's tip number one, to make sure you're getting the right care. So evaluation and follow-up. Some of the things that you may wonder, what tests do I need and why? And these are the things that you can ask your provider. I'm a nurse practitioner. I see patients with the physicians I work with, and they ask me often, why are we getting this test? And sometimes patients do feel a little bit nervous about asking the physician or the doctor themselves. And there's many non-physicians like myself that you can ask these questions to. So you want to know what tests you need and why you need them. So every year, you probably go into an office, or every 6 months or so, and you get a test. And usually the test is an EKG. In many instances, the EKG is very helpful with long QT syndrome and things like that. Like you were just saying with CPVT, the EKG may not be helpful. So there should be other tests that are done. That can be an exercise test, an echocardiogram, Holter monitors. There's a lot of other tests that can be done to help us figure out how you're doing and what condition you may have. Genetic testing, as we've heard and we'll hear more about, is also very important in these SADS conditions. How often do I need follow-up? Most of the time, we see patients on a yearly basis if they're stable and things are going well. If their medication compliance is good. In children, we may have to adjust their medication based on weight. So many times we can do this over the phone. So if you have a young toddler that's growing rapidly, you could call the office and say, hey, my kid gained 5 pounds or something like that, and we may need to adjust the dose. So follow-up, it can range in how often we're seeing patients. Sometimes it's yearly when things are going well, and sometimes it's more often if we need to make adjustments or follow up sooner. And you also want to know who to contact if you have concerns before your next visit. Now, in this day and age, we have patient portals and electronic medical records. So you can actually type your question many times to your provider through a portal. That portal is answered, could be answered by me, it could be answered by Dr. Ackerman, Dr. Bruhl. Those questions are easy to go through, and you can do it on your phone, on your computer. Sometimes you need to call. Sometimes it's more of a discussion. So if I have a patient who sends me a question through the portal and it's going to be a long answer, I will say, when is a good time for me to contact you? I think we need to have more of a conversation. In this day and age, also, we can have virtual care. I will just tell you that I sent a patient to Dr. Ackerman who stayed in Michigan and got the expert care from Dr. Ackerman in Minnesota. We're able to do that now with the technology that we have. And I think that is excellent, too, to know that we are all connected and we can get the information that we need to in a quick way. So you would want to know who to contact, especially at nighttime or on the weekends if something is happening and you need to reach your provider who may not be on call, but they usually have a team of people that you could contact to get your questions answered 24 hours a day. So you need to have those phone numbers and know which phone numbers to use at what time. So genetic testing and counseling, we'll go through this again throughout the rest of the day. Why I should be tested, Dr. Landstrom just answered that question, and that is for personalized medicine. We need to know the genes so we know how to treat people. We also need to know who may be affected. So sometimes with long QT or even CPVT, the tests can be normal, but the patient may have the gene. Doesn't mean we're going to implement treatment just because of the gene test. It just means that we'll follow a little bit closely and know what we're looking for. Who needs to be tested in the family? This is something that your specialist in SADS condition can answer as well. And it's usually first-degree relatives. And what steps do I take to get genetic testing? In many centers, such as my center and Dr. Ackerman's center, we have a genetic counselor. And that person is their job is very specialized in talking to patients about genetic testing and giving them the results. And I think that's very important to know that your center has someone that you can reach out to and that will give you the answers to the tests that you are getting. What should you discuss with your electrophysiologist? So first is treatment options. There are a lot of different treatments out there. And just like Dr. Landstrom said, it could be based on the gene that you have. What are the medications that we can use and the side effects? So there can be side effects of medications. Many of these conditions we use beta blockers. Kids sometimes complain of fatigue and headache, dizziness, things like that. Usually it's not that big of a problem though. We have not had tons of side effects with the beta blockers we've used, especially when they've been on it for at least a few weeks. What exercise can you do? What sports can you play? We have guidelines out there that help us determine these answers, but we also want to work very closely with families. We want to use shared medical decision-making to have these discussions with our families. And the guidelines have changed many, many, many years ago. We restricted all patients who had these types of SADS conditions from doing most competitive sports. You could be a bowler, you could do curling, but you couldn't play baseball and you couldn't run track and you couldn't play hockey. Those recommendations have changed, and our new guidelines really support having people be active. And I think Dr. Kim yesterday talked about a patient that many, many years ago, he had restricted from sports, and then the patient became obese and very depressed. And we also want to keep in mind the mental health of our patients. And in most people that play sports, they love it, and that's where their livelihood comes from. So we have guidelines and we have an idea of what we should do for patients, but we also want to work with our families. So this is something that you should discuss with your provider and know what can and can't be done. Dr. Cannon yesterday was talking about there isn't a carte blanche that you can just go play any kind of football you want. We can put some parameters in play that you can play football, but we want you to stay well hydrated. You can play football, but there has to be an AED nearby. So these are the things that we can work with your families, your schools, your communities. SADS does an amazing job of reaching the communities out there for these types of things. What is the family history? Did anyone have a cardiac arrest before the patient? And these things we take into consideration when giving our recommendations. What symptoms should I be aware of? That's something that's very important. What leads to the need for immediate medical attention? And that's something you really want to work with your physician to know what that is. At the same time, we know in most of these conditions, syncope or passing out is a symptom that we take very seriously. But kids can pass out for non-arrhythmic reasons. And this is why we always stress to our patients to make sure you're drinking enough fluid, because if you pass out because of a non-arrhythmic reason, guess what? 911 is going to be called. And so if patients can be healthy, can eat right, can stay hydrated, then we can avoid some of those passing out episodes from non-arrhythmic reasons. And then what to do if you experience symptoms. I work very closely with our school nurses in the area. I talk to them all the time. They know my name, I know their name, because we work together to create plans. On the SADS website, they also have plans that a person like me can print out and give to a school. So it's very helpful to work with your school, your coaches, and things like that. Dr. Ackerman has always said to work very closely with the coach. You want the coaches to understand the disease and understand what to do so everyone is protected. Long ago in my former life, when I was in college, I worked at a camp for kids with diabetes. And I remember talking to some of the kids that they were embarrassed to share with their friends that they had diabetes. But what we would tell them is, guess what? The friend is going to be with you if you have some issue you need to be treated. So be honest and be open with your friends. At least find one other person that you're comfortable with to share this information. You don't have to broadcast it to the school, but just find someone that you're comfortable with and sharing. So how to make the most of your appointment when you see a provider. We know that providers have to move pretty quickly, but we also want to take the time to make sure that all the questions are answered. So if patients come prepared, it makes it more efficient for us. So before your appointment, choose the top 3 to 4 questions. Write them down. Write down your questions. Again, portals are very good for these questions on off times when you're not at your appointment. Take someone with you, because sometimes you're very nervous at appointments. We see this in patients, and you may not hear everything that the provider is telling you. So take someone with you who can take notes for you, who can actually also hear, and you can go home and discuss it together. And then the SADS website also has a site that teaches you how to prepare for your appointment, and all of these points are on there. So the SADS website is very helpful for all of your questions. How do you find accurate information? So first is your healthcare team. Your healthcare team is going to give you the most accurate information. Secondly, SADS Foundation has a lot of information out there. I would also ask your healthcare team what other sites are viable, what other sites can I go to educate? Because there are a lot of things out there. We all know we can Google anything and you can get 10 different answers, right? So you want to make sure that the site you're going to is based on medical and scientific facts. And so I would ask your healthcare team, can you point me in a direction where I can learn more about long QT, CPVT, any of those things that are websites that we trust and we know, and sometimes we'll go to look up information as well. You have to remember that you're the most important person on your healthcare team. And the more you know, the better prepared you are. So really take notice and understand your disease. As your children age, you also want to make sure that they understand their disease. So we start working with children, around 8 to 10 to really have them understand what their disease is. And by the time they're adults, we want them to be able to tell us what their disease is, what the treatments are, and what the signs and symptoms of concerning things are. So this is our job to prepare your child. It's the same thing that you're doing probably at home as your child ages. When they're little, you pick up after them. You put their towels away, you fold their clothes. When they become teenagers, you say, your turn. You get to do it, because you want to teach them how to live in the world. And it's the same thing from our standpoint, from a healthcare provider standpoint. So there are tons of resources for you on the SADS website. I just went through a few. The SADS website has been updated recently, and it's a lovely website with lots of information. It's very easy to follow. So that's one place you can go. There are other places that you can go. Upbeat.org is another website that is put on by the Heart Rhythm Society and has been, the information, the pediatric side was written by pediatric electrophysiology providers, myself included. So another place that you could go for more information about things. And we know that the SADS website and the Upbeat, they're not contradictory because we've worked together, PACES and SADS, very closely to make sure that we're all sharing the same truthful, scientific, factual information. Resources for you on the SADS website includes the condition-specific information, so you can look up long QT, you can look up CPVT, you can find a physician, so I think that's very important. You can find a physician in your area if you're moving. They have support groups, which are wonderful. I've been part of these support groups, and probably many of you in this room have been part of it, where you connect with other patients who have similar conditions that you do to share your stories, because we know that the bond between patients is very real and very strong, and we want them to feel comfortable talking with other people and talking with people who have been through what they have. The Living with SADS webinars, SADS Live, Dr. Ackerman started that almost 2 years ago, and how many were over 100 and something at the moment for SADS Live, which is a wonderful program on every other Friday afternoon that you can just jump on and learn various different topics. I've been on it a few times myself. Many of our providers in the room have been on sharing with patients information. There are research opportunities, which will be discussed later on, genetic testing information, which will also be discussed later on. And so these are important things to go to and to know about for patients and learning more about their conditions. And sometimes, again, your kids can be on these support groups and join with other kids their age, which I think is very important. And I am happy to take any questions that you may have or just, anything you wanted to share. Thank you. Anyone out there have challenges speaking to your provider, or everyone feels very comfortable? Anyone have tips on how to prepare for your visit? Yeah, go ahead. Sure.
Thank you. I don't currently have a primary care provider, and my condition is very new, and we're still kind of getting to the bottom of things.
Sure.
And I have other issues going on in addition to my heart problem. How do you recommend going about finding someone who can help be kind of your guide for all of the issues you deal with?
Yeah.
Like a good PCP who understands,
Right. That's a great question. So it sounds to me like you're asking, how do you find your medical home? So you need a person that can help coordinate all these specialists. And what we often say in medicine was the right arm's not talking to the left arm. We want to be communicating. And I would say, so to get, to find a good PCP, I would ask for recommendations from your friends, family. I would, if you live in near an academic center, you could ask them. When you do find a PCP, make sure that your specialist communicates very closely with that PCP. So I'm often speaking to primary care doctors explaining, hey, this is the deal. We write letters, but those letters sometimes just kind of get put in the chart and maybe not read as carefully as they should be. But if I really want to tell a primary care doctor something, I will call them and say, I saw X, Y, and Z patient today, and this is what we discussed. This is important. So I did not stress that during this talk. So I do think that primary care and the communities that you are in are just as important as a specialist that you see, because you're going to be seeing them probably more often than your SAD specialist, and they're going to live in your area. So I would make sure that you find a friend or a family member who has a PCP, and actually go interview them, go talk to them and say, look, I have this, and this. Can you tell me how you're going to coordinate and communicate with the specialist? You don't have to take the first physician that you see, the provider you see. You can shop around. And I think that's something that's very important, to make sure that you feel comfortable with your primary care physician, and make sure that they're willing and will speak to your specialists. We're all on the same page. And that's a very important question. So thank you for bringing that up.
I know that a lot of us struggle with finding reliable resources like you talked about.
Sure.
I just wanted to offer something that my cardiologist has suggested, and I downloaded an app called Credible Meds.
Yes.
It helped me tremendously.
Yep. So Credible Meds is a wonderful website. Credible Meds is a website for patients with long QT syndrome on drugs to avoid when you have long QT syndrome that can exacerbate the condition. And the good thing about Credible Meds is it's updating all the time. So we used to print out lists and hand them to patients, and now I do not print out a list because I don't want them to have that false sense of security that this is all inclusive. So crediblemeds.org, you have to register and you have a sign on to get in, but it's free for anyone. And you have to be your own advocate because you could show up at a pharmacy, you could show up in an urgent care, an emergency room that doesn't know long QT, and they could give you a drug that could exacerbate your condition. So make sure you know what drugs to avoid. That's very important. So Credible Meds. Yep, they have a great app on your phone. So it's everyone always has their phone with you, right? Yeah, that's right. So that, and you just type the medication right in, and it will tell you what the risk is. The other people to talk to is to call your specialist. So I get emails and calls from providers, from patients. Is this drug okay for me to take? And it's always a good double check. And I do not ever mind double checking for a patient. They looked on Credible Meds, and so did I, and we came up with the same thing. So 2 heads is better than 1. So if you have any questions, then you can also contact your provider. But great point. Thank you. There are other sites out there like that. BrugadoDrugs.org is another one for patients with Brugada syndrome. And so these are important pieces of information. Those are also on the SADS website. So you can find this information, probably a link to it on the SADS website. So you don't have to go very far to look for it.
Brynn, that was a beautiful talk, and your question in that app is a great one. I just wanted to follow up a little bit on the Credible Meds because there's sometimes some confusion about that. So it's founded by Dr. Ray Woosley, wonderful person, and I've been on the advisory board. And one of the things we've been trying to do unsuccessfully is be able to give you a feeling as to which medicines are really, really dangerous on that list and which ones are sort of, but they got on the list anyway. And we're making a little progress on that. But the point, I think, is for you to be empowered with that list so that's kind of, I view it as the timeout. So when any physician, healthcare provider provides you a prescription with anything, your good assessment to see if they're doing what Brynn talked about is to say, is this drug QT safe? And if they look at you like a deer in headlights, they're probably not the right member of the team.
That's right.
Because they're not respecting the issue. Now, that doesn't mean that every medicine on that list is absolutely off limits. It just means that you needed to review that with Dr. Kim, Dr. Miyake, with Brynn, with somebody, so that together we're making the decision that, yes, it's on the list, but we have enough margin. So you'll find drugs like Ritalin on the list. I have lots of long QT patients with concomitant ADHD where we are meaningfully treating their ADHD.
I will say I do like the last update with the color coding on the top.
Yeah, so it's getting better with that color coding. But I think, so what I want all of you with long QT to do, because the list is irrelevant if you have CPVT. You don't even have to know about that app. This app is only for the long QT families, is the timeout check. It's a great way for you to get a feel if they have sort of QT respect for the possibility that the drug issue is important. Because for many, many families, their only risk is somebody inadvertently stacking the deck and putting you on 1, 2, or 3 medicines on the list and then creating the perfect storm. And so for many families, that's actually the only risk. The risk is super low in many situations, but you can go from super low to really bad if you were in the hospital with pneumonia and somebody treated you with levofloxacin, for example, and nobody's thinking or respecting the QT issue.
That's right. That's right. And that's another point that Dr. Ackerman has made. Many antidepressants are also on the list. And again, in this day and age, we really are paying attention to mental health issues. So patients who need Ritalin, for example, or an antidepressant or anti-anxiety medication, we usually work out a system of how we're just going to follow a little bit more closely. But and just like Dr. Ackerman said, it's the additional medications on top of that. So when you could walk into an emergency room and get Zofran or something like that, which is on the list. So that gives you 2 of those medications and again, this is just QT, prolongs the QT interval. So it's just very important to know what they are and use your provider. So what I would say is if you got prescribed, your child or you got prescribed Ritalin or antidepressant, is I think my child really needs this. They're not doing well in school. How can we work together to make this safe for my child? And we do this often. Just like Dr. Ackerman said, we realized long ago that doing well in school sets a child up for a wonderful life. And so we really want to make sure that the child is doing the best they can in school, because you don't want a child who's sitting at home, I can't do anything. You really want to make sure that child is engaged in school. So great point. In front here.
I probably don't need a mic. Okay, so I am a wife of a CPVT patient, and our daughter has CPVT. Mm-hmm. She's 8 years old, and we were told to no exercise.
Sure.
To limit, but really no exercise. Now, granted, we need to check and see if our doctors on the board and
physician, a SADS referral, sure.
Is she aware of SADS Foundation, etc.? And I could have heard you wrong, but you said there's a list of activities.
So
that's changing, and
so the list of the
mom, I have problems.
Sure.
Just being you can't do anything.
Yeah.
You cannot run.
So this is where I would get, speak, 1, do your research on your provider, and 2, have the discussion, because just like we were talking a lot yesterday about restrictions and sports and things like that, we can work with families in most instances to provide them activities that they can do that can be safe. And so I would work with your provider and make sure that you have an expert, and 2, you make sure that you're having these discussions together. So it's important to, because it's hard to say you can't run. How can you tell an 8-year-old you can't run? I mean, that's just, they run all the time, right? So I think working very closely with your provider and having these discussions are the most important thing. And so what I was talking about from the list is there's a whole classification of sports, and there is a lower risk classification of sports, which includes bowling, riflery, curling, golf, cricket. Did I miss one? Anyway. Sure. So these are the things that you want to discuss with your provider. What are the parameters? Because you can't just say you have to sit on the couch all day. That doesn't work, right? So work with your provider on how to do exercise safely and how much exercise is safe. So I think that's important discussion. And Dr. Ackerman has, and Dr. Brule and everyone in this room, physicians in this room, have these conversations with their patients all the time. It's not one size fits all. We work with each patient individually to have these discussions. And I think that's what we're seeing change over time. We're not saying, oh yeah, everyone can just go play sports now. We are recognizing that different genes, different patients can have, different restrictions and different recommendations. So I'd really have a conversation with your provider on that, making sure that they're an expert first.
Thank you.
Great question. All right. Well, thank you for being here today.
Thanks, Brynn. We're a little bit ahead of schedule, which is great. We always love to do that. But we have a short time for us to stretch our legs, take a quick break, go to the bathroom, which is just around the corner, refill your coffee, and then we'll come back in about 20 minutes to get restarted.